Philadelphia, have you had the single-shot Johnson & Johnson COVID-19 vaccine within the last month? If you experience a severe headache that does not go away, significant abdominal or leg pain that does not subside, or increasing shortness of breath, health officials want you to call your doctor immediately. Those could be signs of an extremely rare, severe type of clot that may be linked to the Johnson & Johnson vaccine. So rare that only 6 cases have been reported in the United States out of the approximately 7 million Johnson & Johnson doses administered to date. However, if you received the J&J vaccine more than a month ago, the risk is very low, said Dr. Ann Schuchat, Principal Deputy Director of the U.S. Centers for Disease Control and Prevention, during a virtual briefing on Tuesday. The CDC announced 6 women between the ages of 18 and 48 had developed a cerebral venous sinus thrombosis, CVST, a clot in the area of the brain that collects and drains oxygen-depleted blood. When this happens, blood cells may break and leak blood into the brain tissues, forming a hemorrhage, according to Johns Hopkins Medicine. The women all developed symptoms of this rare and severe type of blood clot between 6 and 13 days after their J&J vaccination, the CDC said. One of the women died 12 days after receiving the vaccine and entering the hospital with dry heaving, sudden worsening of headache and left-sided weakness, according to a record in the U.S. Department of Health's Vaccine Adverse Event Reporting System. Another woman is in critical condition. Related. What the suspension of Johnson & Johnson COVID-19 vaccine means for you. The cases prompted the CDC and the U.S. Food and Drug Administration to recommend that administration of the J&J COVID-19 vaccine be paused to allow for further investigation. What does a pause mean? It really allows both the U.S. Food and Drug Administration and CDC to further investigate these cases to try and understand some of the mechanisms of what it is. Some more details about the history of the individuals that were involved, said Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, during a White House briefing on Tuesday. In response, Johnson & Johnson decided to pause vaccinations in all of its clinical trials while the company updates guidance for investigators and participants, according to a news release posted Tuesday afternoon. Related, FDA, CDC call for pause on Johnson & Johnson COVID-19 vaccine after blood clot. Reports the CDC's Advisory Committee on Immunization Practices will meet Wednesday and share its subsequent analysis with the FDA for action, the agency said. What does this mean if I've had the J&J vaccine? Don't freak out, I'll be going on with my life, but I would be very attuned to my body, Dr. Carlos Del Rio, Executive Associate Dean at Emory University School of Medicine, told CNN's Poppy Harlow Tuesday.